A young 21-year-old girl comes to me in my OPD with a big lump inside her abdomen. The mother is obviously very scared. Doctor, is it very serious? Doctor, is it cancer? So today let's talk everything you wanted to know about ovarian cysts.
What exactly is a cyst?
So cyst is actually a bubble which is filled with some kind of fluid. When we talk about ovarian cysts, the cyst could be very small in size, maybe just few millimeters or centimeters, ranging to something which could be as big as something which has 3 or 4 liters of fluid inside. Now cyst could be containing simple clear fluid inside, they could be containing blood, they could be containing an old blood when the cyst is known as endometrioma, or there are some interesting kind of cysts in the ovary which are known as dermoid cysts. Now these cysts could be containing fat, cartilage, muscle and all, and maybe even the hair.
What are the symptoms of ovarian cyst?
So in fact, in most of the cases, the ovarian cyst actually may not cause any symptoms. The symptom in some cases could be simply a swelling or a lump in the abdomen. Like this girl, when she came to me, she said that she can feel something and now she's not able to zip up her trousers. There could be pain, there could be heaviness, there could be pressure symptoms because of the ovarian cyst pressing upon the bladder or the rectum behind. There could be increased frequency of urination, there could be constipation. Sometimes there could be a sudden severe pain in the lower abdomen, which is a serious thing. This usually means that cyst is probably undergoing a torsion. Now torsion means that the cyst is actually twisting around its own axis. So in case you've been diagnosed with an ovarian cyst and you suddenly now feel severe pain in the lower abdomen, it is an emergency. Please do not wait. Please report to the nearest hospital.
Can ovarian cysts affect fertility?
So it all depends upon what kind of cyst they are. Simple physiological cysts. Now what are physiological cysts? They come and go, which means during a cycle sometimes they develop and post periods they usually disappear. So these kind of cysts usually do not affect the fertility. While if the cyst is a endometriotic cyst where it is containing blood, now that kind of a cyst may be associated with some adhesions inside, maybe problems in the fallopian tubes, and that can definitely affect the fertility.
When does a cyst become an emergency?
So like I said, in case you've been diagnosed with an ovarian cyst and have a sudden severe pain in the abdomen associated with severe nausea, vomiting, fainting, this is a sign that probably the cyst is undergoing some kind of a twisting and a torsion, and this definitely needs an emergency examination.
Is bloating a sign of ovarian cysts?
Sometimes. Big cysts can cause bloating in case the cyst is pressing upon the rectum or intestine. In fact, the endometriotic cysts also may cause bloating, heaviness, nausea, vomiting. So once again, nausea, vomiting, unexplained, visit a gynecologist.
Do all cysts require surgery?
No, not at all. In fact, this is a myth which I really want to put it on record. In fact, most of the cysts, maybe 90 to 95% of the cysts actually do not need a surgery. We just need to identify the cause, identify the type of cyst it is. Many cysts are actually physiological cysts. They disappear on their own. Some of the cysts actually get well with just a medical treatment. Very few cases we need to operate, and that too in the present times we have techniques like endoscopic surgery, robotic surgery, where through minimal, very small, tiny incisions, big, huge cysts also can be removed without any significant morbidity to the patient, which means patients probably stay in the hospital just a day, not much of a pain, they immediately get back to their work, so it's not that difficult as it used to be in olden times.
Can stress cause cysts?
No, not really. No.
Are cysts cancerous?
Like I said, most of the cysts are non-cancerous. In fact, 98% of the ovarian cysts are benign.
Can lifestyle changes prevent cysts?
Once again, it's not that linear. Following a good lifestyle will improve your good health overall, but saying that you have an endometriotic cyst, you follow a good lifestyle and the cyst will disappear, no, it doesn't work like this. These are specific gynecological conditions and they need specific gynecologic treatment. So please always listen to your gynecologist, and of course keep working on your health also.